Are you pregnant and experiencing a lot of itching? Then be alert because this could be intrahepatic cholestasis of pregnancy. ICP or intrahepatic cholestasis of pregnancy is one of the commonest liver disorders associated with pregnancy. It's seen in almost 2% of pregnant women. The most common symptom that these pregnant women have is itching, that too especially in the night. The itching is mainly in the palms and the soles of the feet, and there is no associated rash. This itching gets worse in the night, and it may be so bad that you cannot even sleep because of the intense desire to itch throughout the night. Now, this is more commonly seen in the late second trimester or the early third trimester. That is somewhere around 28 to 30 weeks of pregnancy. Some women can have other minor symptoms also, like loss of appetite or nausea, fatigue, and a small percentage of women can even have jaundice. Jaundice is seen in only about 5 to 10% women, and the only main symptom which is diagnostic of intrahepatic cholestasis of pregnancy is itching. Now, why do some women have intrahepatic cholestasis of pregnancy while other pregnant women do not have it? So, this is a multifactorial disease, and it has been seen to be genetic also, because if the pregnant woman's mother or sister had this problem during their pregnancy, then it is possible that this pregnant woman would also have intrahepatic cholestasis of pregnancy. It has a hormonal angle to it also, because as the estrogen increases, the itching would increase, and the level of estrogen hormone is maximum in the late second trimester, and that is why the symptoms are maximum during that period of gestation. It is also associated with low levels of vitamin D in pregnant women. Then there are some more high risk factors in pregnancy which make some women more prone to intrahepatic cholestasis of pregnancy, and that is elderly age, or if the woman is carrying twins or multiple pregnancy, as well as if there is a history of intrahepatic cholestasis in previous pregnancy. The recurrence rate for ICP is very high, close to 60 to 70%. Then why does intrahepatic cholestasis of pregnancy happen? So what is the mechanism for this disease? Basically, this happens because the bile flow within the liver is impaired. Now, because the bile is not able to flow through the liver cells properly, so metabolites of bile, like bile acids, they regurgitate into the bloodstream. Now, the pregnant woman would have bile acids in her blood, and this can be transferred through the placenta into the amniotic fluid surrounding the growing baby. So, if a woman has ICP, there is a lot of risk to her developing baby also. It has been seen that ICP is a major cause of unexplained intrauterine fetal death, especially if the bile acid levels are high. If the bile acids are more than 100 micromole per liter, then the chances of having a stillbirth increases drastically. Now, why would bile acids kill the unborn baby? This happens because these bile acids can affect the baby's heart and cause arrhythmias, or the heart rate of the baby would go erratic and the baby can die in utero. Also, it has been seen that bile acids constrict the blood vessels. So, if the blood vessels are constricted, the baby does not get enough oxygen, and then the baby can die of hypoxia. Then it has also been linked to prematurity, to respiratory distress syndrome in the baby once the baby is born, more of meconium stained liquor, and more stays in NICU or the neonatal ICU for the baby. So, this is one disease which has a lot of repercussions on the baby. So, we have to be very alert and pick up this disease early. Now, how do we know that a woman has intrahepatic cholestasis of pregnancy? Firstly, most important is the symptom of itching, and secondly is the increased level of bile acids in the pregnant woman's blood. So we measure total serum bile acids, and if they are high, anything more than 10 millimoles per liter is considered diagnostic of intrahepatic cholestasis of pregnancy. And on the basis of levels of bile acids in the serum, the disease is divided into mild, moderate and severe. So if the serum bile acid level is between 10 to 39 millimoles per liter, then this is graded as mild disease. If it is between 40 to 99, then it is moderate. But if the bile acid level is more than 100 millimoles per liter, then the disease is severe and the risk of unexplained stillbirth rises to more than 3%. Liver function tests can also be done for diagnosis, though they are not as sensitive as serum bile acid levels. So liver enzymes like ALT and AST can be done. Then alkaline phosphatase levels can be done. But alkaline phosphatase, because it is produced by the placenta normally also in pregnancy, it can be raised. So the diagnostic value of these liver enzymes is not too much, and the diagnosis is based on increased serum bile acid levels. Serum bilirubin can be raised mildly in about 5 to 10% of women with ICP, but again, the diagnostic marker for intrahepatic cholestasis of pregnancy stays serum bile acids. So if the woman has symptom of itching and she has increased serum bile acid levels more than 10 millimoles per liter, then the diagnosis of ICP is confirmed. Now, once we know that the woman has got ICP and it can affect her baby in so many negative ways, then it is very, very important to manage this women early. So the management of ICP has three main parts. One is medication, second is monitoring, and third is early delivery. So now talking about medication, we have a tablet ursodeoxycholic acid, UDCA as we call it. So this can be given to lower the serum bile acid in the pregnant women. We start with a dose of 300 milligram twice a day, and if she is not relieved of her symptoms in 1 to 2 weeks, then you can increase the dose to 300 milligram thrice a day also, to a maximum of 2 grams per day. The most common side effect seen with this medication is diarrhea and nausea, vomiting. But the side effects are not so much that the woman cannot take the medication. And with this medication, her symptoms would be relieved in 1 to 2 weeks, and serum bile acids would start decreasing by another week. The second important part of treatment is monitoring. Now, because we know it can lead to sudden IUD, it can lead to meconium stain lica, it can lead to preterm birth. So we need to monitor these pregnant women very, very carefully. The monitoring can be done either by non-stress test or through ultrasound, the biophysical score. The frequency of monitoring would depend upon the level of serum bile acids. So if the serum bile acids are very high, between moderate to severe, then of course you would need to do more frequent antenatal surveillance for the baby. Now, third part was early delivery. Now, this is very important. In mild to moderate, we would generally deliver these pregnant women after 37 weeks of pregnancy. We do not actually wait till term or 40 weeks because sudden unexplained IUDs are common in these women. And if the serum bile acids are more than 100, that is if the woman is in severe ICP, then it is recommended that she should be delivered any time after 36 weeks of pregnancy itself. We do not even wait till 37 or 38 weeks. Then of course you would be doing her monitoring, and whenever you feel that the baby is in danger, we need to deliver such women. So if you have intrahepatic cholestasis of pregnancy, please do not panic. It just means that you need to be more alert and you need to follow with your gynecologist regularly. So be aware and be safe.